everyone. Today I'm going to be going over my medical emergency, anaphylaxis. So what is anaphylaxis? Anaphylaxis is a severe, potentially life-threatening allergic reaction that can occur during dental procedures. So some of the common triggers: medications such as antibiotics and local anesthetics, latex containing materials, and dental materials with flavoring agents. So some of the signs and symptoms we should be aware of: skin flushing such as hives. You can see in this photo, it demonstrates what that can look like. You can also have respiratory issues such as wheezing, throat tightness, shortness of breath. There's also neurological issues such as dizziness and confusion. And then gastrointestinal such as nausea, vomiting. And then we can also have cardiovascular. Hypotension is also an example of what they can have. So how does the medical condition affect the body? Your blood pressure drops suddenly, which can cause fainting, and it can also cause shock. You can have swelling in the throat or tongue, which will then cause difficulty breathing. So the main symptoms are trouble breathing, dizziness or fainting, skin rashes or hives, and then in severe cases, loss of consciousness. On the right, we have an image of a patient. You can see they have swollen eyes, lips, and their tongue. And then you also get an internal image, so you can kind of see what it looks like if the tongue were to swell, blocking off the airway. So what are the oral cavity reactions to this? So as I mentioned, swelling of lips, tongue or throat, and then if the tongue swells, it can block the airway. You can also have itchiness or redness in the mouth. So why is it important that we know these signs? Oral symptoms may be the first warnings, and the dentist must act fast. Not only the dentist, the whole team needs to act fast if there's swelling or trouble breathing. And then on the right, you see a patient with a swollen tongue, so you can really see how big it can get, almost covering the whole mouth. So statistics on anaphylaxis, it is rare, but it's a very serious emergency. So dentists may only see one case in their lifetime, and although it is rare, just being aware of the signs can save someone's life. So as I mentioned, why is it dangerous? Well, it can cause breathing problems, low blood pressure and shock. And these fatal reactions, they happen under 5 to 15 minutes. So acting quickly is very important. Medication allergies are very common in the dental setting. So someone could be allergic to anesthetics and they can go into anaphylactic shock in just a couple minutes. So it's very important to be aware of the symptoms. So some global health facts. It is on the rise worldwide. So about 46 cases per 100,000 people each year. In the US, 1.6% to 5.1% of people have had at least one reaction. So although it is rare, we are seeing more cases. So always important to be aware of something so serious. And on the right, we do see a woman that's having some swelling in her face and eyelids. So that is another example of what it can look like. So some first response medications in order to treat it. Epinephrine is the first and most important medication we use to treat it. So patients are usually given auto-injectors once they do experience an allergic reaction to something. They are given a copy. That way, if they do have it, let's say in the dental setting, they may even have it in their purse or bag, and we can grab a hold of it and help the patient and administer it. So epinephrine right now is the only medication that can stop severe allergic reactions. There are secondary treatment options such as antihistamines, but those are only to kind of manage the symptoms. It's not going to actually stop someone from going into anaphylactic shock. So it's very important that we're aware that epinephrine is the only medication that we can use right now. On the right, you see a picture of what those auto-injectors look like. So a very awesome thing I discovered while researching was that there is a new drug called Neffy. They did approve it in August of 2024. And the great thing about Neffy, it's a nasal spray. So you can use it just like you would use an EpiPen, and it's needle free. And the great thing again is, since it's not a needle, it's not scary for most people to use, because studies did show 56% of parents were actually scared of using EpiPens incorrectly. And then not only parents or family members, but up to 83% of caregivers delayed or didn't use them when needed. So this is a great innovation because it makes it so that everyone feels comfortable helping someone in an emergency. And on the right, you see a picture of neffy. So I wanted to include an image of how it's used because it is very simple and easy. One, you just remove it from the packaging. You hold it properly so you can see the grasp. You insert into the nostril and then you press down. Just one spray is enough to use neffy. So you can see not only is it less terrifying to use for people who are terrified of needles, but it's very hard to make a mistake. A lot of people, when they're using the EpiPen, they turn it upside down and they actually inject their own finger instead of someone's thigh. So this is a way, it's a foolproof way to save someone's life, and it's not scary. So how does it work? Like I mentioned before, it's just one spray in the nozzle. It's great for people who are afraid of needles. It's easy to use even in emergencies. Once again, it reduces mistakes, so you don't have to worry about the angle you're turning in. You just put it up in the nostril and spray it. So it's fast, and especially under a stressful situation, as if someone's going in anaphylactic shock and their throat's locking up, spray in the nose and you're good to go. There's nothing to be worried about. And once again, kids and adults with needle fear don't have to worry about this. It could be used in public places or schools. neffy also mentioned they make it very easy for someone to get a hold of. So us being dental assistants, you're able to purchase this and have it on you because it can happen anywhere and you can save someone's life. So how is the oral cavity affected by the medication epinephrine? So some adults have reported they get pale skin, shaking, fast heartbeat, headache, or dizziness. We also see similarities in children as well, but they can also have tingling hands, feet, and nausea. Oral health considerations, there are no known side effects on teeth or gums. They may have tingling in the lips or tongue, so that especially happens in children. You can also have swelling or airway issues from the allergy, but not epinephrine. So it is important to note that. Special care patients are adults over 80. They may have a higher risk of heart problems, especially with epinephrine. It is a vasoconstrictor, so it would provide, it would make the heart rate, the heart pressure go up. So blood pressure will go up if you use epinephrine. So patients with heart problems and or older adults may have risk while taking epinephrine. So that is very important to monitor those patients after giving them epinephrine. So clinical considerations, once I mentioned before, trouble breathing, swelling, low blood pressure, or skin reactions, we need to act immediately. That's the most important thing. We give epinephrine right away. Anaphylaxis can happen within minutes. They can die. So we need to make sure we recognize it, we act immediately, we have our emergency meds ready. So that's why it's always important to have those stocked up, the EpiPen or neffy. Make sure that the staff knows how to use them. Maybe someone's afraid to use an EpiPen, but they can use neffy. Just make sure they are aware of how to use everything. Another thing is to check patient history. We must review if they have any allergies before treatment and also document if they do have allergies with us. That way we can keep track and make sure we're aware of a patient's allergies. And once again, train your team. We need to practice emergency drills regularly. Everyone should know their role and communicate. If there's chaos going on, someone can die because someone can die within minutes of having anaphylaxis. The throat locks up, they can't breathe. If everyone's scrambling around, they're not getting their epinephrine, they're not getting the ability to breathe. So it is very important that we have everything organized. So what do? Let's go over a patient scenario. We have Sarah, she's 34, she's undergoing a routine dental extraction under local anesthesia. She's had mild seasonal allergies before, but she has no known drug allergies. So after she gets amoxicillin and a local anesthetic, Sarah suddenly develops shortness of breath. She feels lightheaded, papillations, mild swelling of the lips and face, but there's no skin rash right now on her body. So what do? Well, the team knows that although she may not have a rash, you can still have anaphylaxis. So just from the other symptoms she has, we know that she has it. So we must stop treatment immediately. We activate office emergency plan. We call EMS immediately. We remove potential allergens and we place the patient up in a supine position. And then we know that we need to administer the medication. So epinephrine is given immediately, whether that's an EpiPen or neffy up the nostril. And then if they need oxygen, we also provide that. So the most important thing is that the team reacted quickly because they could be showing these signs and then a few minutes later, their throat's going to lock up. So now what do? After we do that, we need to make sure that our patient's vital signs are monitored. We need to make sure that they're stable before EMS arrives. We need to make sure that they're still breathing. If the team is scrambling around and they don't get their medication, this patient could have their throat locking up. They could stop breathing. So it's very important that we're on top of everything. Once the hospital care arrives, they're going to transport her to the hospital, but we also need to make sure that we're documenting things, the incident report. Maybe we noticed that when we use latex gloves, that's when her throat started, she had trouble breathing. So it's very important that we document those things. That way the hospital knows what they're dealing with and they can help Sarah a lot better. So there's also an aftermath. It's very important that Sarah now gets a medical clearance. So she needs to go talk to her doctor, figure out what she's allergic to, what medications or materials the dental team needs to avoid, and what to do in a medical emergency. So it's very important before we have dental treatment with Sarah again that she needs to get a clearance from a doctor, because we do not want to take her in again not knowing that she could be allergic to latex gloves, or maybe she's allergic to the flavoring and the dental cleaning. It's very important we are aware of what it is so it doesn't happen again, because maybe next time we don't respond fast enough, or maybe next time it's very severe and her throat locks up and she can't breathe. So very, very important we get a clearance. So once we get that, we're going to update her patient file. Allergy warnings are added to her patient chart. We list known allergies. That includes how to take care of her in proper care. And the patient file gives the dental staff an alert before we treat them. So how should the dental office respond after this emergency? So Sarah may need antibiotics. So her doctor may let us know that we need to give her antibiotics before she gets treatment. The dental office may start not using latex gloves with her. So it's very important that we have that updated for her next treatments. And we may make her appointments shorter next time to keep it less stressful. Another important thing is that we need to update the office emergency plan and tools. So maybe when this happened, a lot of the staff weren't aware of what anaphylaxis was and they didn't respond quick enough. It's very important that everyone is aware of the signs and acts accordingly. Another thing could be maybe when they were going through the emergency kit, they noticed we only had one EpiPen left. So it's very important that we stock up. We have all the tools we need, because what if Sarah was aware of her allergy and she didn't have her EpiPen and now the office doesn't either? That can lead to her dying, So we need to make sure that everything is set, and that way we can have a safe treatment option. We need to adjust, and that's why it's also important to have someone kind of check every few months or even weeks just to make sure everything's stocked up and everyone is aware of what to do. So there can be many causes of anaphylaxis in the dental setting. So as I mentioned, it could be antibiotics. I personally am also allergic to amoxicillin and penicillin. I get a rash on my body. My grandma, actually, when she takes it, her throat locks up. So now when I go to any medical setting, I let them know, hey, I'm allergic to this, so they're aware, because it can develop into anaphylaxis, and it's very important to just be aware of anything that can cause it. So not only that, but sedatives, flavoring we use, dental cleanings, gloves, bite blocks, anything that can have latex a patient could be allergic to. So just be aware there are many things that patient could be allergic to. And that's why it's more important that the patient goes to their doctor so they can actually figure out what it is. So then we actually know what the triggers are and we don't use those triggers. So who is at higher risk for it? Older adults, especially over 65. Men are actually more likely to have it because of a combination of biological health and exposure factors. People with asthma or other lung problems like COPD, people with heart disease, those with mastocytosis, it's a condition with too many allergy cells in the body. They are at higher risk. People taking beta blockers or ACE inhibitors, so heart and blood pressure meds. People with past severe allergic reactions. People exposed to medications, insect stings, or medical procedures. And anyone who delays using epinephrine. So even just having a delay in epinephrine to an allergic reaction can result in anaphylaxis. So that's a very important reason why we need to make sure to act immediately. So prevention, treatment for medical emergency. Emergency plans are a must. Every dental office needs a clear plan for allergic reactions like anaphylaxis. That plan should be used right away when symptoms start, because like I mentioned before, 5 to 15 minutes, someone can die from this. Practice makes perfect. The team should practice emergency drills, especially for allergic reactions. These drills will help everyone know what to do, work together better, and stay calm and confident in real situations. The better we're calm and prepared, we can react very quickly and make sure no one passes away from this unfortunate condition. So it's very important we're on top of this. So again, what to remember, we recognize the signs, we know how to treat it. Anaphylaxis is very serious and it can happen very quickly. It needs immediate action. We don't wait for a rash or skin symptoms because, as I mentioned, we saw in our example, they may not have a rash, but they might have trouble breathing, low blood pressure, fainting, or dizziness. So don't wait. We need to make sure we act right away, especially if we're aware that the patient has an allergy. We're going to start EMS right away, and we're going to give epinephrine immediately. We do not delay that. And then after, as I mentioned, we need to make sure what the allergic reaction was from, and then how it was caused, and what can we do for future appointments. And also document, and make sure it's in the patient file, and get medical clearance. This is so important. Thank you for listening to my presentation. This is my works cited page. And then here is my image cited page. Thank you, everyone.